Okay, so this is my video for Pronator Teres syndrome. So my scenario was a 68-year-old seamstress with Pronator Teres syndrome. So I did a bunch of research and I found a bunch of things that we could do conservatively due to her age and her occupation. I think that would be the best route to do instead of jumping right to surgery. So the first thing was a posture and ergonomic assessment. So we could look up from the forearm through the neck, shoulder, and down through the arm to the hand to see if there's anything that she's doing throughout her days that are also impacting nerves. I would also recommend rest from work. I mean, not ideal, can't always do it, but avoiding those aggravating motions would help her significantly. A lot of the literature suggested resting in supination, so I would tell her to do that. Nerve gliding was also mentioned, but it had mixed evidence, so I decided that I didn't want to include it in this video. And there was a lot of positive research on modalities and massage just to take away the muscle tightness and the soft tissue restrictions that are pushing on that median nerve and causing that irritation through the forearm. They also talk about using medications such as dexamethasone and things like that to decrease inflammation. And then stretching, which is huge. So today for my video, I'm going to focus on using ultrasound on the Pronator Teres and a Pronator Teres stretch that we could have her do at home, which is pretty easy. So I took a carpal tunnel article that was cited throughout Pronator Teres research, and I stole their numbers. So first thing, this is my patient Morgan. What we need to take into thought is that the Pronator Teres has two muscles. There's that superficial head that goes all the way up to the medial condyle of the humerus, and then there's the deep head that goes to the medial margin of the coronoid process on the ulna, and then they both go to about the middle part of the radius. So we just need to make sure that we're getting that whole area. So, jelly up.
Mm-hmm.
You ready?
Mm-hmm.
Okay. And then, so what the literature says is to do 15 minutes at a frequency of 1 and an intensity of 1. Yep. And then we're doing it at a duty cycle of 20, but the literature says 25. This machine just only goes 10, 20, and 50. So ideally, we would try to find a machine that does 25. And then in the study, they did this 5 times a week for 2 weeks. And then they looked at symptoms and the other outcome measures. And then they did it 2 times a week for 5 weeks following that. And what they looked for were a lot of things, but what they found was significant was by the end of the 7 weeks of treatment and at a 6-month follow-up, that subjective symptoms decreased, physical function increased, which they measured as hand and finger grip, and a patient rating of overall improvement in function was reported. So that's what we would want to see with this treatment here too. So we're going to say that was 15 minutes. Okay. Thanks. Mm-hmm. And then, so we're going to let Morgan clean herself up for a second. She's a good patient. Next thing, what I would do was teach her a Pronator Teres stretch, which she can do at home quite easily. So what she'll do is she'll just place her hand underneath her wrist, so you're not hitting any of those muscles of the wrist or through the forearm. And the cue is just pull your thumb down and your pinky up. Looks great. And hopefully that will loosen up the tissues that are bothering that median nerve and give some pain and paresthesia relief.